my name is S.Cornell, and this is my head-to-toe assessment. This is my patient, Courtney. Prior to entering the room, Courtney emptied her bladder. She changed into a gown. Her height and weight were taken, as well as a set of vitals, and her distant and near vision was also tested in the hallway. Those were both 20/20. We're going to start with her head and her face and her scalp. The skin is pink, there's no lesions. Her scalp is normocephalic with no lesions that I'm able to see through her hair or anything. Her face is symmetrical, as well as the eyes and the ears. Upon palpation of her scalp, there are no nodules felt. Any tenderness?
Nope.
Nope. Okay, her hair is evenly distributed and it's good texture. We're going to palpate the facial bones. Do you have any pain or tenderness with that?
Nope.
Okay. Next, we're going to palpate the frontal and maxillary sinuses. Any pain or tenderness with that?
No.
No? Okay. Next, we're going to palpate the temporomandibular joint. So I'm going to have you open and close your mouth. Any pain or tenderness with that?
Nope.
Okay, no popping or clicking was heard. Next, we're going to move to her eyes. The skin is pink on her eyelids. There's no lesions present. Her eyebrows are full. Her eyelashes extend upward. Her conjunctiva is pink and her sclera is white. I'm going to palpate her lacrimal apparatus. There's no swelling. Do you have any pain?
No.
Okay. Next, we're going to test her pupillary response. Her eyes, or her pupils are equal, round, and reactive. Next, we're going to do direct and consensual pupillary constriction. Direct, consensual, direct, consensual. Next, we're going to do the cover-uncover test. So I'm going to have you look at that gold thing on the wall and then cover your right eye. Okay. Next, cover, same thing, focus, and then cover on your left eye. Perfect. I was looking for any jerking or nystagmus or extraocular movements, and there was none. Next, we're going to do the 6 cardinal fields of vision. I just want you to follow my finger without moving your head. I'm also looking for jerking or nystagmus with this. And none was present. Next, we're going to move to her ears. Her ears are symmetrical. The auricles, there are no nodules or masses felt. Is there any tenderness or pain there?
No.
No? Okay. If I had an otoscope, I would look in her ears at her tympanic membranes. They should be pearly gray, movable. And I would look at her canals, her auditory canal, or ear canals. There should be no exudate, swelling, or redness, and there's none present. Next, we're going to do the whisper test. So I'm going to whisper into both ears one at a time, and I just want you to repeat what I say.
Ball. Orange.
Okay, good. Next, we're going to use the tuning fork, and we're going to do the Weber and Rhine testing, which are also hearing tests. I'm going to strike the tuning fork for the Weber and stick it on top of your head. I just want you to tell me if you hear the sound bilaterally or more in one ear than the other.
Bilaterally.
Perfect. And that's normal. Next, we're going to do the Rhine test, which I'm going to strike the tuning fork and place it on the bone behind your ear. I want you to tell me when you no longer hear that sound, and then I'm going to move it in front of your ear, and then I want you to tell me when you no longer hear that sound.
No.
Okay, and that's good as well. The air conduction should be greater than the bone conduction, which it was, so that was normal for that as well. Next, we're going to move to the nose. Her nose is midline. Her septum is midline. Her mucosa is pink and moist. And there's no drainage, and her nasal terminates are pink, moist, and intact. We're going to do a nasal patency test, so I'm going to have you close one nostril and breathe out the other, like huff, and then do the same on the other side. Her nostrils are patent. Next, we're going to move to her mouth. Her lips are pink, they're dry, there's no fissures or cracks. I'm gonna have you open your mouth and show your teeth and your gums. Her teeth are white, there's no missing teeth and there's no broken teeth. Her gums are pink and not recessed. I'm gonna have you open your mouth. Her buccal mucosa is pink and moist. I'm able to visualize the hard and soft palate, also pink and moist. I'm able to visualize her tonsils, her anterior posterior pillars, her posterior pharynx, and her uvula. Can you say ah? Okay, and the uvula rises midline. Next, I want you to stick out your tongue. Can you move it from side to side? Perfect. And then up and down. I'm able to visualize the floor of her mouth. Okay, and next we're going to do the gag reflex. I'm gonna gag you, sorry. Okay, that's intact. Next we're going to move to her neck. Sorry, the neck is symmetrical on both sides. The skin is pink and dry. There's no lesions present. Her trachea is midline. There's no goiter present. I'm also not able to see any jugular venous distension. Next, I'm going to palpate each carotid artery one at a time so as not to make her pass out. Both are felt. Both are 2+. Next, I'm going to palpate her trachea. It's smooth and midline. Next, I'm going to palpate her thyroid. I'm going to have you swallow while I palpate. The thyroid is smooth with no nodules. Next, I'm going to palpate all of her lymph nodes. So there's preauricular, postauricular, the occipital, the superficial cervical chain, the posterior cervical chain, the deep cervical chain, the submandibular, the submental, and the tonsillar, the supraclavicular, the infraclavicular, and then raise your armpits just a little, and the axillary. None of the nodes were swollen. Did you have any tenderness with any of that?
No.
Okay. And no tenderness present. Next, we're going to test your range of motion. So I just want you to follow my movements, and then when we're done, we're going to do the same things with resistance. So shrug your shoulders, turn your head side to side, front and back, and then touch your ear to both shoulders. Perfect. So now let's do it with resistance. Okay? Good. All's intact. And next, we're going to listen to the carotids for any bruise with the bell. Same with the thyroid. And none are present. Next, we're going to move to the upper extremities. I'm going to inspect and palpate the musculature, the temperature, and her skin. Her skin is warm, pink, dry, and good musculature. Her hair is evenly distributed. Her fingers, her nail beds are intact. Her capillary refill is less than 2 seconds. There's no cyanosis present. Same on this hand. And then I'm going to feel her pulses, her radial, and her brachial. And those are both 2+ on both sides. Next, we're going to move to your posterior chest, so I'm going to have you turn around. All right. First, we're going to inspect her skin on her back. It's pink. There's no lesions intact. It's dry from what I can see. Her posterior to anterior chest dimension is 1 to 2. And then we're going to assess her respiratory rate and rhythm is equal and regular. Next, we're going to assess her costovertebral angle. You should have no pain or tenderness with this. Next, we're gonna move to her lungs. We are going to first palpate expansion. So I'm gonna place my hands on both sides underneath the 10th rib, and I'm gonna have Courtney take a deep breath. Perfect. And the expansion on both sides was symmetrical with that breath. Next, I'm gonna palpate tactile fremitus. So every time every time I move my hands, I want you to say 99. I'm listening for, or feeling for equal vibrations on both sides. So say 99.
99, 99, 99, 99, 99.
Perfect. Next, I'm going to move to percussion. So I'm going to percuss the lung sounds on your back and then on your lateral chest. We should hear resonance all throughout. Perfect. Now I'm going to have you raise your arms on the lateral side. Okay, good. Resonance was heard all throughout. Next, we're going to do diaphragmatic excursion. So I'm going to have you cross your arms and kind of lean forward a little bit. We're going to percuss downwards while you have a big, huge, deep breath that you're holding. Then I'm going to have you take a couple of deep breaths, and then I'm going to have you let all the air out, and we're going to percuss downward again. And the difference between the two, where the two sound changes, should be 3 to 5 centimeters.
Okay.
And that's how much your diaphragm expands. Okay, so take a deep breath. Right there. Okay, take a couple deep breaths, a couple deep breaths. And then go ahead and let all of your air out. Right there. So about that distance, that's perfect. Next, we're going to listen to all of your lung sounds. Deep breath. Perfect. All those lung sounds were equal and clear on both sides. Lift your arms straight up, and we're going to do the lateral chest. Deep breath. Perfect. All of those sounds were also equal and clear bilaterally. Next, we're going to move to your anterior chest, so go ahead and flip around. We're first going to assess the skin. There's no lesions. Her skin is pink. We're looking at her respiratory rate and rhythm, which is equal and symmetrical on both sides. Next, we're looking for respiratory distress. She's not using any accessory muscles to breathe, and she seems to be in no distress. There's no pulsations or heaves that are present that I'm able to see. Next, we're going to palpate her chest wall. Any pain or tenderness with that? Okay. Next, we're going to palpate the precordium at the base, or the apex, I'm sorry. The left sternal border in the base. And then we're going to palpate the apical pulse. Next, we're going to percuss the chest. Yeah, that's right. Percuss the chest. Resonance was heard throughout. Next, we're going to listen to all of those same lung fields. Sound should be clear and bilateral equally. They are clear and equal on both sides. Next, we're going to listen to the heart sounds at the apical. Aortic, pulmonic, Erb's point, tricuspid, and mitral. All of those sounds were regular, the rhythm was regular, and she had no murmur heard. Okay, next we're going to move to your abdomen. So you can lie down. So first we're going to look at the skin, inspect the skin for her color. It's pink, there's no lesions present. We're going to look for contour. It looks pretty symmetrical. There's no movement that I'm able to see. Next we're going to listen. In all 4 quadrants for vowel sounds for up to 2 minutes. If we're still unable to hear vowel sounds, after 2 minutes we can listen to her up to 5 minutes in any quadrant. Okay. Next we're going to listen to her arteries. First her aortic. And her renal. Next, her iliac. And her femoral. All were listened to with the bell of my stethoscope, and there were no bruits present. Next, we're going to percuss her abdomen. I should hear timpani sounds over air-filled spaces and dole sounds over organs. Perfect. Next, we're going to percuss her liver border on the right side. So first I'm going to percuss upwards until I hear a sound change, until I hear dullness. And then I'm going to percuss downwards until I hear dullness. And the distance between the 2 points should be 6 to 12 centimeters. So first going upward. Right there. Next going downward. Right there. And that is 6 to 12 centimeters. Next we're going to look for splenic dullness. So I'm going to percuss downwards, and then I'm going to have you take a deep breath, and we're going to do it again. And if there's any sound change, that could mean splenic enlargement. Okay? Okay, deep breath. Hold it. Okay, good. No sound change. Next, we're going to lightly palpate the abdomen, looking for any masses or nodules, any tenderness with that?
No.
Okay. Next, we're going to palpate, deep palpate the abdomen. Also looking for any nodules or masses, any tenderness with that? No. Next, we're going to deep palpate for the liver edge. And there it is. Now we're going to palpate to feel splenic enlargement. Should not be able to feel it. And I'm not. Next, we're going to feel for the kidneys. And then I want you to barely, like you're about to sit up, but then hold it, and I'm gonna palpate your abdominal muscles. Okay, they're symmetrical, perfect, you can sit up. Next, we're gonna move to her legs. We're feeling for musculature, good musculature. Her legs are pink, there's no swelling present. They're dry, the hair distribution, obviously she's a girl, she shaves her legs, so there's no way to tell that, but it probably would be normal. Next, her feet. Her nail beds are intact, they're pink, no cyanosis present, and her capillary refill on both sides are less than 2 seconds. We're gonna feel for her pulses, her popliteal, dorsalis pedis, and her posttibial. All were felt, all were 2+. Next, we're going to move to the cranial nerves. So, the purposes of this exam, cranial nerve 1 was not assessed. Cranial nerve 2 was assessed during the near and distant vision testing. Cranial nerve 3, 4, and 6 were tested during the 6 cardinal fields of vision. Cranial nerve 5, we're going to test that next. So I have sharp and dull. I'll let you feel what they feel like. Sharp and dull. I'm going to do it on your face, and I just want you to tell me if it's sharp or dull. So close your eyes.
Sharp, dull, dull, sharp, dull. I mean sharp. Sharp, dull.
Okay, perfect. That's intact. Cranial nerve 7 is the facial nerve. Can you blow out your cheeks? Smile, frown, and wrinkle your forehead. Okay, that cranial nerve is intact. Cranial nerve 8 was the acoustic, and that was intact. We tested that with the whisper, the Weber, and the Rhine. Cranial nerve 9 and 10 were intact. That was the gag reflex, and then testing the uvula. Then cranial nerve 11 was intact. That was with the shrug, shoulder shrug, and the range of motion on her neck. And then cranial nerve 12, that's also intact. We tested most of it with the oral assessment, but we're going to test, I'm going to have her push with her tongue against my hand that's on the outside of her cheek. Perfect. We're also going to do light or sharp and dull sensation on her legs and arms. So I'm going to have you go ahead and close your eyes.
Sharp, dull, sharp, 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 dull, sharp, dull, 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 sharp, dull, sharp.
Perfect. All is intact. Next, we're going to test her musculature. I'm going to do her reflexes first. So the brachial. Perfect. Okay. Next, we're going to do the knees. Funny bones. And then the Achilles tendon. Perfect. All of those are intact. I'm going to have you, so we're just going to test all of your musculature. So we did a lot of it with your range of motion and the resistance. We're going to do your arms, so stick them straight out and then just resist my pressing. Now out. Okay, and then your legs. Perfect. Next, I'm going to have you stand up and do a squat. Test that musculature. Good. And then we're going to assess, I'm going to feel your spine. Feeling smooth, no nodules or anything. Okay, and then I want you to lean forward, hanging your arms. I'm going to feel for scoliosis. Good, none's present. That's it. That's the end of my head to toe assessment.